Welcome to yet another episode of the Dynamic CIO. In the last 1 year, the future of healthcare has been shaping up in front of our very eyes with advances in the digital healthcare technologies, artificial intelligence, AI as we call it. VR, AR, 3D printing, robotics, nanotechnology, digital twins have all revolutionized the patient care and the precision medicine model. The emergence of artificial intelligence and data analytics as a tool for better healthcare offers unprecedented opportunities to improve patient and clinical team outcomes, reduce cost, and impact population health. Now, we see the future of healthcare go hand in hand in technology. Additionally, how healthcare workers have to embrace the emerging healthcare technologies in order to stay relevant in the coming years. To discuss this and a lot more, we have with us today Dileep Mangsuli, Head of Development Center, Siemens Healthineers, who will speak to us on using new technologies to help healthcare providers in India make better informed decisions. A few words about him. He's a strategic and a decisive technology leader who has built global engineering teams across India, US, Europe, China, and has launched new products worldwide. He's passionate about customers, technology, and innovation with a strong focus on improving customer impact and business outcomes. Welcome to the show, Dileep.
Hey, thanks, Smruti. Yeah, great to meet you virtually.
Virtual. Yeah. Thank you so much, sir. So without much, wasting much of your time, let me straight jump into this conversation that, a very interesting conversation that I foresee. So starting, obviously because we're talking with the technology community, how is technology changing the healthcare in India? And obviously I will have to ask a pandemic related question. What has been its impact during this pandemic?
Well, I think the biggest impact, if pandemic could do positively, in India globally has been the acceleration of technology. What was not possible a couple of years back, today it has been made possible. There is a saying that sometimes for decades nothing happens, and sometimes within weeks a decade happens. And that's exactly what happened in India too. I'll give you an example. During the second wave of pandemic, like many other companies, even our company got impacted. And there were many employees who were, COVID impacted. And during that time, more than 90% of the people managed their disease with teleconsultation. That was the biggest impact that you could see. According to estimates by Niti Aayog, the teleconsultation grew more than 3 times in last 1.5 years. In fact, this is a very conservative estimate. I know of several, startups who had started teleconsultation. Their business grew like crazy. That changed in a big way. Secondly, I think how people started using digital technologies for improving the healthcare in last couple of years has actually tripled. The estimated growth because of the acceleration that digital has picked up is in India, it is expected to be at least about 31 to 32% in next few years. This is an irreversible change that has occurred in industry, and rightly so. For many years, we have been struggling to really figure out how do you bring access of healthcare to all the population. How do you improve affordability? How do you really get accuracy in diagnostic? And all this was possible only through diagnostic processes using digital technologies. Now, that is more likely possible now. I call this as a AAA of healthcare: affordability, accessibility, and accuracy. And that is taking a huge growth in India. I'm really excited about it.
As now we've said, the new normal is what we talk about, and technology, digitization, as I would say it, has become from a nice to have to a must have now. And with healthcare being in the forefront and everybody realizing the importance, I think the blend of digitization and technology and the different methods in this very, very crucial industry, I think is the way to go. Also I think it will help make much better informed decisions. So adding to that, how you think would help new technologies, how would they blend with the healthcare providers to make better informed decisions?
You bring in a very great question, Smruti. Think about it this way. During our 20, 30 years back, those who could afford, they will always have one family doctor, right? A family doctor was a great asset because family doctor always knew the history of patient. He knew history of patient, history of family, and he knew what works, what is the allergy and all. Anytime someone is not well, they will be treated with the right dose of medication, and a person will get well very soon. But in today's changing world where people move from one place to another at the drop of a hat, it is difficult to get a family doctor. You go to a new clinician every time. Now, to treat a patient, to treat a disease, it is equally important that you know well about patient as well as the disease. If you know both, is when you will be able to give a very good treatment. And that's what we call it as precision medicine. How do you detect it correctly and how do you detect it quickly? And if you are able to do that, then you make a better decision. And as a clinician, you'll be able to make a much, much better impact on the patient's health. Now, think about in today's world, everything has become digital. Starting from your wearable devices, which churn out data about your heartbeat every second, every minute, to your oxygen percentage. Apple Watch gives you everything. It keeps telling you so much of data. Look at the other data coming from your health exercises or the diagnostic data, pathology data. Everything is digital. Now the data itself is getting doubled every 73 days. The data gets doubled globally. Now think about using this data in a right way and combining this data to create insight about disease, to create insight about patient, can be a game changer for a clinician. Imagine if you are able to work with a patient, know his genomic data. Genomics will tell you about what's going to work for him, what's not going to work for him. Know about his past historic data. All that combined can give you instantly, without asking 100 questions, you get a historic perspective about a patient. Indian government is trying to do this new health stack policy, digital health stack policy, which is going to make the data available. A patient who owns the data can make it available to any clinician he works with. And the moment he has it, the intellect that is, analytics that is created can give him a better tool to make a quicker decision. Typically, a doctor spends about 3 minutes with a patient in a conversation. Now, in 3 minutes, how much you ask and how much you make a judgment of. Now, if the data can give you all that background, then your decision-making is far better, your treatment is far better, and you can make an impact far better. Now, in Siemens Healthineers, we have acquired recently a new company called Varian. Now, the Varian is known to treat the entire disease pathway of cancer, from early detection, screening to therapy and post-therapy. How do you treat a patient? Now, all that is possible because of so much of data that you generate about the disease, about the patient, and using that to the right effectiveness. And to me, these are the exciting facts. In the future, you will get the analytics which will help you make a better decision. We're not saying that the machine will make a decision for you, but machine will help you make a right decision for you.
I like your point very aptly, as a clinician, what you said that, you need to, obviously you need to understand the disease, but you need to understand the patient. That's far more important, apart from studying and learning about the disease. And I truly, after you're listening to your 3-minute time, which a doctor spends with me now, I am thinking myself that this doctor needs to know my history. He or she will never know my history in 3 minutes. And this is very, very crucial. So I think, your technology will help make better informed decisions. Now, we spoke about a lot of data, which is there, so how is data and analytics playing a very crucial part in boosting the quality of patient care?
Great point. Quality, end of the day, we have any healthcare company tries to look at a few things. For Siemens Healthineers, it is three great aspects. One is, of course, precision health. This is going to be the future. Precision health, how do you expand it? How do you improve the care delivery? And how do you improve the patient experience? Patient experience is most important. Many times, as an equipment seller, many people may forget about patient, but you can't forget about patient. How does it get a better quality, better care? And that is what we are trying to look at. Using digital data, how do you reduce errors? Today, more than 25% of the patients stay in the hospital is because of errors in medical industry. Because of errors, people end up staying in hospital, or wrong diagnosis can actually add a lot of cost to the patient. And there is an estimate of over $1 trillion of money that is wasted because of medical errors. This is an estimate. There's no one can really give you the number. Hey, here is how it happened. But it is expected that the number is very, very high. So how do you bring that, and how do you make the patient's experience better? Is what the data can actually give. By creating early diagnostics, you are treating the disease even before it reaches the peak. Early screening can help treat a patient even before he needs to get into a hospital, cut it in the bud. And that is going to improve the quality. Now think about a patient who is able to manage his own health better. There are technologies now which are coming where you can actually create digital twin of certain parts of the body or entire human body. A digital twin can continuously tell you how well you are doing in terms of your health. Is there any intervention required for you to really get treated? Those will help quality-wise in terms of his lifestyle. You know very well that today people wear the diabetes patches, and they have a device which continuously tells how is their health in terms of the sugar content in the body. And based on that, their food content can be changed. And that improves their health in the long run, because they won't get into a place where they need to be treated for failure of organs. So early treatment, better treatment, reducing errors, improving the care in the hospital by improving the entire workflow of a patient. For example, when a patient enters the hospital and when he gets out of the hospital, how minimum time he can spend in the hospital can be done through digital tools. How do you make sure that a patient, when he is told in the morning that you can be discharged today, and today anywhere from 2 to 8 hours is the time it takes once the doctor tells the patient that you are discharged today. For him to get out of the hospital, it takes that much time. And no one loves to stay in the hospital. They want to just get up. And digital tools will help in getting that. And similarly, all the diagnostic tools, what we talked about, those also help in making a right judgment for a patient to really manage his health better.
I can empathize with all what you said, and I'm actually feeling that you're actually reading my mind while talking all of this, because I have gone through a situation where I had a family member who was admitted for COVID, wrong error in the report, and it costed their life. I have parents at home who have patches whom I keep monitoring sugar about, and I understand the discharge process, which takes a lot of. That's why I said you're reading my mind, and when you were actually saying all of this. So yeah, this is very real. It's not all just, for the sake of it. And I think if the technology plays such a good role, I think it will be a boon for every layman, every user in the country. And see, for you, your customer is the patient, a patient who doesn't want to continue being a patient for a long time. So he doesn't want to continue being your customer for a long time, and you're looking at that benefit. And I think that's a great boon to the humanity and mankind. And currently in the current situation in the pandemic, I think it's amazing. You spoke about digital twin.
Yeah.
Can you tell me more about it?
Yeah, it's a very interesting thing. I think the twin itself as a concept, we are so used to seeing twins in Bollywood, and Bollywood actually dramatizes a lot more. If you pinch one twin, the other twin gets the pain. And actually in digital twin, we are talking about similar thing. And concept-wise, technology in physics sense exists today. If you look at aviation industry, when an aircraft is flying, there's a real-time analytics about how the aircraft engine is behaving is calculated real time. And they're able to predict what is likely to happen after 2 hours or 2 days or 2 months. It is only because they have created the mimicking situation based on multiple data points, multiple engine points, and they are able to do that. Now think about doing the same thing on human being. If I can have my own twin digitally created where I take the data from different sources, and there's so much data available today, right? In fact, just about a few days back, we had a genomic expert speaking to our teams. And genomics can tell you so much about everything what is likely to happen to your body, what works well, what doesn't work well. And look at the data that is coming with the digital stack policy that every country is doing. Your data will be owned by you, and that can be used to create what is likely to happen. Was there a certain problem that was there with you, and how is it progressing, disease progressing over years? Can you extrapolate it? How do you look at the data that is coming from your food habits? How do you look at data coming from your exercise that you do? How many steps you took? How many pizzas did you eat, and how much walk did you do? And taking all this data, you can create a model, a digital model. And today, I think we have reached to a point where you can make the models of different organs. We have still not reached a point where a complete human body is created as a digital twin, but the day is not far. We have always seen that the acceleration happens so fast, the logarithmic curve, the future is much, much, much faster than we expect. So today, digital twin of a heart can tell you what is likely to happen. For example, if you're doing resynchronization therapy on a cardiac resynchronization therapy, if you are keeping electrodes for resynchronization, how will heart work if you place it in a certain position? Is it a better position, or somewhere else will be a better position? You will be able to know that. Similarly, I think you can try a few of the surgical things on the heart and see what is likely to happen. And if you are able to do that on a digital twin, and see the effect, and go do it on a real organ. And that is an exciting future that we see, with liver, with other parts of the body. You continue to build it, and over time, including your, the cardiac, how is likely to happen, how is likely to be a buildup of, the calcium scoring on your heart, what is likely to change. All that can be managed with a digital twin. So while you eat food, you keep entering the data, and that will become automated in the future, and you will be able to see and manage your health much better. So will others who will be trying to manage you, clinicians remotely, can manage it better with everyone's digital twin available somewhere.
Sounds extremely exciting. It is very exciting.
Yeah.
In the paucity of time, I'll ask you one last question, Dileep. Going into the future, what is your advice to the healthcare industry? When you talk about their journey towards digital and IT transformations, we know that it's accelerated 10x already because of the pandemic. But any advice, last words that you would want to give them?
Well, I think, Smruti, one of the things that when we were talking, we talked so much about, different people actually contributing to data. We talked about genomics. We talked about, the data coming from wearables. We talked about data coming from food habits or the mental health, or so many things. And if you think about it, is there one company which actually gets all this data? No, there's not one single company which can provide all this data. Is there one company which can actually create all these models? No, it cannot be. it has to be something where you should not be working in silo. And innovation, we talk so much about, the transformation of healthcare, we talk so much about, is only possible when you bring people together, when you bring companies together, when you bring diverse thoughts together. And, here is where we believe that co-creation is going to be the future. We believe partnership is going to be the future. We believe that like-minded companies coming together. We believe the agile startups will bring in a lot to the table, where they bring in some new technologies and work with companies like Siemens Healthineers, who can actually provide a much better market access, as well as provide a combined solution which can be world changer. World needs the better healthcare. And if anything that we understood during pandemic, that we are not ready. If anything that we realized is whatever we thought we were very good at, we were still not good enough. And what you see behind me, a building, is where Siemens Healthineers is focused. We committed to India, and we are spending about 1,300 crores to build a new campus, which is going to be an innovation hub, where we want to co-create with a lot of healthcare providers, non-healthcare providers, to make a difference to the world from India, for India and rest of the world. And we are going to be adding another 1,800 to 2,000 people in the coming years. A lot of digital and healthcare technologies. India will become the hub, and people with a purpose to really improve the healthcare industry are welcome to really become partner with us and make a difference to the world. And I'm excited in this year.
It was very exciting, and I think the vision that you have, and I really hope that you achieve this vision. Amazing. I mean, it was such an amazing talk that I had with you today. So much to learn from you about healthcare, about digital twins, about your focus on the patient and your as a customer, what Siemens is doing, and what is the future roadmap for you. And for specifically when you spoke about India, it really brings a lot of pride in for this healthcare industry. So thank you so much for spending this time. And on behalf of Dynamic CIO, I would like to thank you for this session.
Thank you. It was great talking to you.